arrive at the Cardiac Care Center, you will present yourself at the registration desk, and either a nurse or a clerk will show you to the chair or the stretcher area that you will be waiting and to be prepared for your procedure. Depending on the kind of procedure you're going to have also depends on the kind of preparation that you will need. First thing that we will have you do is change into a hospital gown where all of your clothing will need to be removed. We will present you with a patient belonging bag where you're welcome to use to keep all of your belongings in. Your family is welcome to stay with you when you arrive in the area. They can stay with you while you're being prepared if you choose. And there is a family waiting area where they could also wait if you both choose that option. When you arrive, the nurse will go through your chart and your history and ask you many questions, specifically the spelling of your first and last name to verify your correct information, and also will verify your birth date. A second nurse will also go through that same information with you just to verify that we always have the correct spelling of your name. You will be asked to bring all of your medication along with a list of the medications that you're presently taking. Please bring them with you on the day of your procedure, and the nurse that admits you will verify the medications that you are taking. We like to keep a copy of the medication list to keep in your chart, and we will verify that when you are leaving that you may or may not remain on the same medications. In preparation for your procedure, there may be some clipping and shaving of body hair. It is dependent on the type of procedure that you are having, and the nurses will ensure your privacy at all times. All patients are required to have an intravenous access. You may have intravenous fluid hanging, or you also may have a saline lock inserted in case we need to give you medication or fluids during your procedure. To ensure your comfort during your procedure, you will be offered sedation, and depending on your procedure, you may be given it prior to going into the lab underneath your tongue, or you may be given a sedation in the form of intravenous. So here in the Cardiac Care Center, we do use computers for documentation. You may notice that the nurses, as they are asking you questions, will utilize a computer either at your bedside or at the nursing station. That will ensure accuracy and timely documentation of all information. When you return to the recovery area after your procedure, you will return with your tubes still in place. They will be removed, and your blood pressure, heart rate, oxygen saturation will also be monitored continuously, and it will seem that it's quite frequent. You will be able to drink while you're recovering for the first little while, and after approximately an hour, you'll be able to have something to eat. If your approach is through your femoral artery, which is your leg, you will be flat on your back for 3 hours after the procedure, and then we'll gradually raise your head and have you take a walk and be discharged an hour after that. So 4 hours in total. If the procedure is done through your wrist, through your radial artery, the clamp will be loosened and you'll be able to leave in approximately 3 hours. The nurse will go over discharge instructions with you. Any follow-up appointments will be discussed, and also any medications that you need to be taking will be talked about as well. Feel free at any time to ask questions of any of the nurses and of the volunteers. So when you're ready for discharge, your family will be required to bring a wheelchair. They can obtain them from the front of the hospital and bring them to the recovery area for you to be discharged home in. Your discharge instructions will be reviewed with your nurse. Any questions will be answered, so please feel free to ask as many questions as you have. A written discharge instruction sheet will be given to you for you to take home. We'll also discuss any medications that you need to continue or new medications that may have been started, and also follow-up instructions will be reviewed in terms of which doctors to see at what time.